Hi, I'm Dr. Greg Anderson from South Surrey Chiropractic Clinic. Do you suffer from back pain? Back pain that may be due to spinal stenosis, herniated disc, or even lower back pain of unknown origin? Then spinal decompression may be part of your answer. What is spinal decompression? Well, spinal decompression therapy is kind of a fancy form of traction. Traction has been around for many, many years, but this type of traction is a little bit different. Spinal decompression therapy is actually run by a computer system. So what I've done in this particular patient's case, Charmaine's case, is I've set up a program that's based on her clinical problem, which in her case is a herniated disc. What we're going to do is we're going to run a program. Now the spinal decompression is when I hook up the pulley mechanism, as you see in this particular picture. We are going to actually add weight to her body to essentially pull the vertebra apart, taking pressure away from the nerve root. As we do this, the pressure will stay off the nerve root, and the nerve root will have a tendency to start calming down. The inflammation will start going down, which should alleviate the muscle spasm and the pain. Now the way the table works is that we're going to start it in slow increments of 10 poundage. That's going to take about 2 minutes to reach the plateau level of 50 pounds is the dosage we're going to use in Charmaine's case, based on her clinical symptoms. Then that's going to run for 12 minutes. Then we're going to release it at the same manner. We're going to release it at 10 pounds, taking about 2 minutes each increment, just to slowly release it so essentially you don't feel anything. What you're going to feel during the treatment is some pulling. That's essentially all. There's usually no pain associated with this procedure at all. Now, Charmaine, do you have any questions?
Yes. How many treatments will this take?
How many treatments will this take? In your particular case, we would start with about 10 treatments. We're going to see you about 3 times a week. Each treatment is going to last between about 17 minutes to 24 minutes, depending upon your clinical case. And then at 10 visits, we should see some improvement in your case, but it may take longer yet. Some cases take 20, some take 15. It just varies on the particular case. Any other questions, Charmaine?
No, thank you.
Good. Why don't we start? Now we're going to complete the strapping process that will secure Charmaine before we actually start the procedure. I've already got her strapped in with the abdominal belt, which is connected to the pulley in the computer. Now we're going to put the thoracic portion on, and this will lock in the rib cage so we have a nice snug fit. Is that comfortable?
I'm very comfortable, thank you.
Good, and there usually is no discomfort with this process at all. We've also got these pads in that go under the armpits that will keep you from sliding down as the pulley mechanism works. I'm also going to give you this button, which just is a safety feature on the machine in case you have any problems. Unlikely you will, but if you do, you just press the red button and it stops the machine.
Thank you.
Now we're ready to actually start the process. So Charmaine, what I'm going to do, I'm going to press the button to start it, and what you're going to feel is a very gentle pull in increments of about 10 pounds until we reach our 50 pounds. Now the machine's starting to pull very, very gently, and you're just going to feel very, very slight tug, but very gentle. So this is a very gentle process, and will not experience any pain during the process. Now we've completed the spinal decompression process. So what next? So you have back pain. You want to know what we can do for it. Well, the first thing you want to do is come in and let's talk about it. Do a consultation and an assessment on you. If you need spinal decompression, we can determine that at that time. And that's something that I would do actually when I do the consultation and examination. At that point, we would prescribe the therapies and actually do the therapies. Questions people say, well, wait a minute now. Am I eligible? Is it going to help me? Well, that's something we would do during the consultation and examination. We would determine if spinal decompression is the treatment for you. Or maybe even conventional chiropractic may be the treatment for you in this case. We don't know until we actually do an assessment on you. So I'd be more than happy to have a look at your back. By all means, send me an email. I'll answer it. Or if you want to contact the office, you can do that too, and we can set up an appointment. Thank you very much.